Assalamu alaikum guys, this is Dr. Faiz and today our topic is drugs for osteoporosis. So drug for osteoporosis, today we will discuss 5 drugs for the treatment of osteoporosis: bisphosphonates, teriparatide, and monoclonal antibody, that is denosumab, calcitonin, and raloxifene. So first of all, we are going to study the bisphosphonate. Bisphosphonate are the first line therapy for the osteoporosis. You people know about the osteoporosis causes and pathogenesis. So here we are just going to study the pharmacology. So the first line drug is bisphosphonates. What is bisphosphonate? When two phosphate group are linked by the carbon atom, this is called bisphosphonates. Otherwise, if these two phosphate are linked by the oxygen group, this is called pyrophosphate. Now, there are 2 types of the bisphosphonates. Number 1 is the IV and number 2 is the oral bisphosphonates. In oral bisphosphonate, there is alendronate and risedronate. And the IV bisphosphonates, there are 3 drugs: pamidronate, abandronate, and zoledronate. So, in oral bisphosphonates like alendronate and risedronate, the side effect is GI upset and esophagitis. This is high yield point. The esophagitis, it causes esophagitis, the oral bisphosphonates. And after taking the oral bisphosphonate, the patient or the person must be in upright position for 30 minutes. Next is the IV bisphosphonates. IV bisphosphonates have also side effect flu-like symptom. What's its dose? Its dose is after 3 months or annually, just a single dose. Okay, so after bisphosphonates, that is the first line therapy to osteoporosis. Now, what is a mechanism of the bisphosphonate? Actually, there are cells, you people know, osteoclast, that cause the bone resorption and then the bone become weak. So actually, bisphosphonates bind to the calcium that accumulate in the bone. When this bisphosphonate is taken up by the osteoclast, it inactivates the osteoclast, induce apoptosis of the osteoclast, and so osteoclast destroyed or inhibit their function. Now that's why then after blocking the activity of osteoblast and apoptosis of the osteoclast, the bone resorption becomes stopped. Next drug is the teriparatide. Teriparatide is recombinant human parathyroid hormone, PTH. So you people know that what's the function of PTH? PTH actually increases the serum calcium. So it is recombinant human parathyroid hormone, teriparatide, and what it does, it increases the serum calcium level. So after increasing the serum calcium level, the osteoblast bone formation also increases. So that's why the bone density then become normalized. And what its dose, it is subcutaneously injected daily. So we have done the bisphosphonate, teriparatide. Next drug is the denosumab. Denosumab is monoclonal antibody. Now what is how its function? There is rank ligand on the surface of the osteoblast and the rank receptor on the surface of osteoclast. So when this stimulate this or give signal, then osteoclast do the bone resorption. So what does the monoclonal antibody does? It inhibits the rank L receptor. So there is no stimulation of rank ligands. So there is no stimulation and no bone resorption by the osteoclast. Next is the calcitonin. You people know that calcitonin inhibits the osteoclast, so inhibit bone resorption. So the last drug is raloxifene. Raloxifene is actually SERM, selective estrogen receptor modulator. Selective estrogen. So SERM, selective estrogen receptor modulator, its action is same like the estrogen like action on the bone. So you people know that estrogen increase the deposition of bone, so that's why it prevents the osteoporosis, mainly in the female after the menopause, after the 40 to 45 years menopause occur, in which there is no estrogen production, so there is no deposition of the calcium on the bone. There will be bone weakness and osteoporosis occur. So to prevent that, we prescribe the raloxifene. So we have done today the drug for osteoporosis, that are the bisphosphonates. oral bisphosphonates and IV. That is the next is the teriparatide. The third is denosumab, calcitonin, and ralazepine. Thank you so much.